Hey, good afternoon, and thank you all for coming here this afternoon. I appreciate everybody coming out. As the Department of Health indicated earlier today, yesterday we discovered what we believe is the first case of coronavirus here in the state of Rhode Island. We've all been watching the news over the past few weeks, and I understand why many Rhode Islanders may be concerned or even frightened. I've been hearing about it from constituents for the past week, and that's why I've decided to address Rhode Islanders this morning. My primary message to the people of Rhode Island this morning is that the risk here in Rhode Island at this point is low, and we have been preparing for this for weeks. We did not wake up today and just get started in our preparations. And I want everybody to understand that following Dr. Nicole Alexander-Scott's lead, my cabinet and I, the whole administration, in concert with the federal government, the CDC, and the FDA, we have been preparing for weeks for this eventuality, and we have an excellent plan in place. So the message is be careful and be vigilant, but don't panic. And know that we have an excellent plan in place that's already working. I have been getting daily, twice daily, 3 times daily briefings and updates from my team, of course from the Department of Health, and we've had close collaboration already, even beyond my administration, but with school superintendents and mayors, etc. I'm going to turn it over to Dr. Scott in a few minutes, but I wanted to offer a few more thoughts. I want to repeat again for everybody. At this point in time, the general level of risk for Rhode Islanders is low. There is no need for panic. There is no need to be frightened. I also would say, let's get that message to our children. Kids have to be aware. They have to be careful. They have to be vigilant. We all have to be washing our hands, using hand sanitizer, being smart about it, but there is no need for panic. Everybody in Rhode Island has a role to play in this preparedness, and Dr. Alexander-Scott will go through the details. I'd like to cannot emphasize this enough. Every single one of us has to play a role in being prepared and in limiting the spread of this illness. If you feel sick, stay home. If you're starting to feel sick, don't go to work. Don't go to school. If you are with other people, if you're in a crowded place, wash your hands. Sneeze into a tissue. Sneeze into your sleeve. Keep a distance from folks who are sick. Just be smart about it. I cannot emphasize this enough. We are prepared. This is evolving. We're going to continue to evolve our plans as this evolves. But every single one of us has an opportunity to play our role to make sure that the public health of Rhode Island is maintained. Finally, it's very, very important that we all stay informed. Please visit the Department of Health's website, the CDC website, every day. As I said, this is evolving. We're going to stay on top of this every minute, every day, every week. So it's incredibly important that all of us in the community stay informed and have the latest information so we can take the necessary steps to keep everybody safe. But I stand before you confident that we have a plan and that we're doing everything that we know how to do to keep Rhode Islanders safe. So with that, I'd like to turn it over to Dr. Nicole Alexander-Scott, and I'd like to take a minute to thank her and her team at the Department of Health who've been working overtime for weeks to make sure that Rhode Island is in the best shape that we can be and to make sure we're all collaborating and coordinating. That is the key message. Collaborate, coordinate, share information, stay informed, and use common sense. Thank you.
Thank you, Governor. Good afternoon. We definitely appreciate you for your support and for your leadership. I also want to thank those who are here because of the work that has gone into this. We have known that this will happen. We have prepared for it. And with the teams that are in place, we are ready to respond. I want to thank Director Pappas and the entire team at the Rhode Island Emergency Management Agency, and reiterate the Governor's appreciation to our staff and leaders at the Rhode Island Department of Health. I'm joined here by a few of those leaders who are here to respond to our questions regarding the COVID-19 response team. First, I'll introduce Alicia Mahalakas, who's our Director of the Center for Emergency Preparedness and Response. Christine Goulette, who's our Director of the Division of Preparedness, Response, Infectious Disease, and Epidemiology. And Dr. Eva King, who is the Director of our State Health Laboratories, which has been crucial in this response today. There are dozens of other people throughout the department who've been working tirelessly on this issue for several weeks. And this weekend, we've taken an all-hands-on-deck approach. We've been supported for the last several weeks by staff from agencies throughout state government. They include the Executive Office of Health and Human Services, the Rhode Island Department of Behavioral Health Care, Developmental Disabilities, and Hospitals, the Rhode Island Department of Education, the Department of Human Services, the Department of Environmental Management, and the Department of and the Rhode Island Commerce as well. We've also been getting great communications support from our friends at United Way and 211, and I want to say a special thank you to Courtney, their president and CEO. As we indicated in the press release that was issued this morning, yesterday we identified our first presumptive positive case of COVID-19 at our Rideau State Health Laboratories. This was an individual in their 40s who recently returned from a trip to Europe, which included time in Italy, France, and Spain. This individual is being treated in the hospital right now, and our thoughts are certainly with this person and their family to continue towards a full recovery. Beyond that level of information, out of respect for their privacy, there is not much more we're going to release about this individual. And I thank you in advance for respecting that. So I said earlier that this is a presumptive positive. In the past few weeks, Dr. Eva King and her team at the Rideau State Health Laboratories worked to develop the capacity to perform testing for COVID-19 virus. That is the novel coronavirus 2019. In response to an urgent need, the State Health Laboratories expedited the final steps of implementation to run the tests that resulted in identification of this first case of COVID-19. The positive test results here in Rhode Island must also be confirmed by the CDC laboratories, as with every presumptive positive case in the country. What the major task is for us before us now is to continue the extensive contact tracing work that has already begun. That means we will be identifying all the people who could have had direct contact with this patient. This outreach to people in direct contact with this individual has already begun. Fortunately, this person had very limited travel in Rhode Island after returning from Europe. The patient had not returned to work after coming back from their trip. This individual's immediate family members have been self-quarantining at home since it was determined that based on this person's travel history and symptoms, the individual met criteria to be evaluated for COVID-19. We have been working very closely with them. And at this point, no one else who lived in this person's home has developed any symptoms. That is a critical factor. We have a team of epidemiologists and other public health professionals who are working to contact this individual's additional contacts beyond the household contacts, which is the primary round. These additional contacts are being asked to self-quarantine for a period of 14 days from their last potential exposure to this individual. That means not going to work, not going to school, and staying home. Our team at the Rhode Island Department of Health will be working very closely with each of those individuals, making sure that they have the support they need as they are being asked to monitor themselves for any symptoms during this 14-day time period. We will have public health nurses checking in with them several times a day. We are being extremely vigilant in this scenario. The Rhode Island Department of Health has been preparing for weeks to ensure that we have a structure in place to the best of our ability, limit or prevent the spread of COVID-19 in Rhode Island. We fully anticipated standing before you at some point to make the announcement we are making today. We are not seeing widespread community transmission in Rhode Island. And that means the general level of risk for Rhode Islanders is still low. Another important thing to know is that the risk level is very low for someone who is a contact of a contact. That's also an important message. At the same time, I want to echo what Governor Raimondo has said. Everyone can assist us in working to prevent the spread of viruses like COVID-19 as well as the flu, which we know is circulating. Washing your hands is critical. Washing your hands multiple times throughout the day works well, using warm soap and water, and if soap and water are not available, using alcohol-based hand gel. And also, an important message. Please, if you are feeling sick, stay home from work or school. We have been working to communicate to businesses and schools how important this message is, so that everyone can be supported in being able to do that. I want to reiterate it now so that everyone can hear. If you're not feeling well, just stay home. That's in advance of running to a healthcare facility. If you feel like you're okay to stay home when you're not feeling well, that is the best place for you to be. Coughing and sneezing into your arm or tissue is also critical. If you've not received your flu shot, this is an opportunity to do that as well. Not because the flu shot protects against COVID-19, but the flu shot helps decrease your risk of needing to go to the hospital with the flu if you develop severe symptoms. The flu shot is also helpful for protecting the people who are around you against the flu. We need to keep everyone as healthy as possible. Another key reminder is that masks are not recommended for people in the general public who are healthy. Wearing a mask is primarily reserved for a healthcare provider or someone who has symptoms, and if they are ill. Masks are usually to prevent the spread of illness that already exists. Someone who is well, the CDC does not say that there is any benefit in wearing a mask. And a key component is we want to be able to preserve masks to make sure that they are available for the healthcare providers who will need them. Finally, it's very important that people know when to go to a hospital emergency department and when not to. Generally speaking, many types of illnesses and injuries do not require an emergency department visit. Going to an emergency department for an illness or injury that could be treated by monitoring yourself at home or communicating with your primary care provider will be important to understand. If you just go to the emergency room when it could be handled in other settings, it will likely just result in an extended wait time at the emergency department. So we want to make sure people have the support needed to stay home if they are showing symptoms and ill and do not feel like it's severe enough to require an emergency department visit. There are quicker and less expensive treatment options that are available for people if they are ill. If you have recently traveled from an area with widespread or ongoing community spread of COVID-19 and you have symptoms that are concerning to you, call your healthcare provider. We are working closely with healthcare providers so that if such a call comes through, they can reach us directly. We want to do what we can to support people being able to stay home. That is the best place to be if you have symptoms and are not severe or severely ill enough to require hospitalization. So before pausing to take questions, I want to wrap up by saying that everyone should take a deep breath. That's an important component to this. We knew that this would occur. We have been preparing for it with the governor's leadership. We have a very coordinated system across the administration. And the most important element is the message to you all. We're monitoring this isolated situation directly. There is no widespread community illness in Rhode Island at this time, and the level of risk for the everyday Rhode Islander is low. Whether or not it is the flu, which is circulating, or this concern, the ability to stay home if you are ill with symptoms is the best response. There is much more flu circulating in Rhode Island right now, and that presents a context to how we are dealing with this. The same prevention measures to prevent the spread of flu can prevent the spread of COVID-19. So with that, I want to thank everyone who's here, thank the media for continuing to help share this message, and thank the governor for her leadership as we open it up to questions.
Governor, are you satisfied with the level of response by the Department of Health and the other departments?
Yes, I'm very satisfied. As I've said, we planned as if this was going to happen. We are not surprised about the fact that we have someone that we presume has coronavirus. We've been waiting for this day. We're prepared for this day, and the Department of Health has been at the lead doing that. Frankly, the fact that they've been able to have their testing capacity up and ready is a testament to that. So, look, we're going to be guided by the science. This is an evolving situation, and we are staying on top of it. We will be guided by facts and science and epidemiology, and so we will be reporting out as often as we need to people. But if you're asking me how I feel about where we are right now, I feel very good about where we are right now, and I think Rhode Islanders should feel confident in the level of preparedness that the state has.
You don't agree with the CDC's response to the state?
Yes. Again, this is evolving, but as I stand here this morning, or this afternoon, yes.
How many people are we talking about that are in quarantine, roughly? Contacts of contacts, all of them related to this case?
So we are being careful in terms of numbers because we want to allow the family to respond. There are contacts of the individual that we are reaching out to, and that number is around 40 or so people that we will be engaging with and already have started connecting with them, giving them the instructions about being able to stay home and monitor themselves for symptoms. We're making sure that they'll have a thermometer and what they need to be able to check for a temperature each day. We will have a public health nurse that will be calling them and engaging with them to help ensure that they are doing well and that they understand what to do if symptoms occur.
Governor,
Was this victim one of the 26 that you had previously told us was quarantined and being monitored?
No.
So this is outside the 26.
when did that person return to Rhode Island?
That person returned in the middle of the last weekend, on the 22nd.
Governor, from a basic milk and bread standpoint, what does the average Rhode Islander need to do to be prepared for this, whether it's supplies or plans? What should everyone be doing starting right now?
Washing your hands several times a day. Avoiding, just be smart about it. Be smart about it. So if you feel sick, stay home. If your kids feel sick, keep them home from school. If you are, starting to feel very sick, call your physician. We want to be smart about this. We don't want people to be panicked. There is no need for panic. You just want to use some common sense. And the most important thing, as has been said, is stay home if you're not feeling well. This morning, like a lot of Rhode Islanders, I went to Mass. So use common sense. Wash your hands after Mass. If you sneeze, sneeze into a sleeve, sneeze into a Kleenex. In terms of milk and bread and supplies, it isn't at that stage. It's just, at this point, stay informed. This is going to change day by day. Stay informed. Be smart about washing your hands. And if you don't feel well, keep yourself at home. And call your physician. Don't run to the emergency room. Just, behave as you would in any other circumstance if you're not feeling well.
Director,
Dr.
does your
Dr. Scott.
testing protocol differ from the CDC's? You said this was treated as a presumptive positive, and yet you needed verification from the CDC. How do they differ? And going forward, you have the capability to verify that someone is infected.
This is the same process that every state is using throughout the country. Because this is a new test that we are all using on a novel virus, we are running the same test that the CDC is again repeating. And that's the protocol that they have asked for, and that's what we are doing.
Are there enough tests? There seems to be a shortage of tests nationwide. In fact, as of yesterday, the report was only 500 people in the country have been tested for this.
There are enough tests thanks to the leadership of our state health laboratories with Dr. King. But we want to be judicious in how we're approaching it, which is why we have a system that's set up where we are determining in collaboration with the healthcare provider when it's appropriate to use the test and when not to. This is something that's an important element because prior to this happening, the CDC was conducting all of the tests for Rhode Island because of the challenges that were happening. But as mentioned, our state health laboratory has been working diligently to build the capacity for it, and we're able to expedite it this weekend so that we could identify this case here in Rhode Island.
Doctor, you said in the release that if someone was not showing symptoms, if they've been exposed to an individual outside their home setting, the virus cannot spread to people in the community. So you're saying if someone is not showing any symptoms but might have been exposed, that it can't spread?
Correct. Based on the information that we have today and based on our communications with the CDC, how we are approaching it is only making a change or doing testing if someone has symptoms. If they do not have symptoms, they are not considered someone who is at high risk of spreading the infection. So that's an important message, and it's also why we said it is unlikely for you to get infected if you are exposed to the contact of a contact. You need to be exposed to someone who actually has symptoms.
How many people are now being monitored how many people on self-quarantine are now in total? You had 40 people with this person, and is that in addition to the 26?
That's in addition.
So,
In terms of how many have been tested, Doctor?
We are following the protocol that has been recommended and is being pushed out through the CDC, which connects to only testing people who have symptoms. If you do not have symptoms, we are working with people closely to make sure they are monitoring themselves for symptoms and then treating them differently. But if they have not had symptoms, we are not testing, and that's what's happening across the country.
How many have been tested?
Protocol, excuse me, in terms of the protocol for frontline healthcare workers, have you given new instructions to hospitals or emergency rooms or nursing homes about what they should be doing?
We are working very closely with the healthcare facilities throughout the state. The message is evolving as the CDC and others learn more, and so we're doing what we can to make sure that that message is pushed out to all of our healthcare partners who have been responsive and are doing everything they can with this very evolving situation.
Director, right now there's a finite number of tests. Are these tests exclusively for Rhode Islanders? In other words, another state, the CDC, couldn't utilize the physical tests that you're describing right now?
Thanks to our Rido State Health Laboratories, we have the tests that we need for Rhode Islanders. And we're going to monitor that system so that we can respond the way we need to.
Are you
How many have been
interested in
tested?
the
How many-
identity of particular school districts in relation to this most recent case? And can you elaborate on which communities might be more directly impacted by this particular case of coronavirus?
We are working with all of the sectors that we need to throughout the state. The message is the same in terms of being able to stay home if you're ill. So that means businesses, that means schools as well, faith-based institutions. We want to help make sure that everyone has the information that they need. If you are ill, stay home. Symptoms are what's required in order to actually spread the infection. So if someone is out and does not have symptoms, the risk of spreading throughout the community is lower. And that's why it's important to monitor for people, which is the message that we are giving to people who have traveled to places where COVID-19 is prevalent.
How many people have been tested? How many people have been tested in total?
Why not answer that question, Doctor? How many people have been tested?
That situation is continuing to evolve. We are focusing on testing the people who have symptoms. So we
10,
are
12,
connecting
100
with
people?
them. No, it's not a large number at this time.
What, if the person went to came back from the trip on the 22nd, when did he or she, and can you tell it's a he or she? I mean, that's not, we'll respect the privacy, but the Boston case we know, it was a man
In their 40s.
in the 40s. A man or a woman?
It's a man.
Man. And when did he go to the hospital?
He has gone to the hospital within this week. A key part to the message for him is that he did not return to work while he had symptoms. He accessed the healthcare setting, and the healthcare providers have been responsive. So that's an important component, knowing that you have to have symptoms in order to have a higher risk of spreading the illness.
And what hospital did he go to?
We're not releasing that at this point.
Was the family with him on the trip? Was it a family trip?
We are not releasing that information as well.
Two more questions, guys.
Governor, can you talk about your coordination just a little bit more extensively with the White House on this? If you talked to Vice President Pence today, then Dr. Scott, can you explain a little bit more about the flight path for this patient? You know, was he in an area that was a hotbed for where they're seeing a lot of this coronavirus right now? And even in France too, did he travel in those areas where that virus was most prevalent?
We do have the association of travel as being a likely source for this patient becoming infected. And so looking at the list of countries that have prevalent illness right now is most likely an associated factor for where this man acquired the infection.
Director, from the time that this person went to the hospital for the first time to the point that they were tested for coronavirus, were they assessed for any other conditions, anything like that? In other words, was there a gap between reporting symptoms and a test being conducted?
As soon as he entered the healthcare facility that he is being cared for now, COVID-19 was a definite consideration. The other viruses that can resemble COVID-19 have also been tested for and assessed.
I'll answer your question. I have not personally been in touch with the Vice President. However, my office has been in touch with the White House and will continue to do that. I've also been in close contact with the Rhode Island's federal delegation, and it is my sincere hope that the federal government will provide additional resources for states that are going to have to deal with coronavirus. And I know that our federal delegation, I've been in touch with Senator Reid, Congressman Langevin, they are working hard to make that happen. And of course, we are in constant contact with the CDC.
How can the public have confidence in the president when the experts say the president doesn't know what he's talking about and he doesn't talk to the experts?
Yeah. What I can tell you is that here in Rhode Island, we are prepared for this. We, as I say, we are following the science. We are following best practices, and as it evolves, we will continue to step up our reaction and response.
All right, thank you guys. Thank you very much.
What the symptoms are, because
That's important. Go ahead.
we say you need to have these symptoms to be tested. So what are the symptoms people should look for?
The symptoms are very similar to what happens with the flu or other respiratory viruses. Fever and respiratory symptoms such as cough or something that worsens from there. So those are the overall symptoms that we're monitoring for.
And this individual, we understand his identity is not being released. We know that, but there are concerns that he was around students and educator. Is there anything that you can provide us when it comes to the school district and students, you know, the risk and safety of these students?
Absolutely. We certainly understand those concerns, and we are working very closely with anyone that has had contact with them. We're also working with all of the sectors that are involved so that they have everything that they need and can make sure that anyone who may be impacted has the information needed. We are wrapping our hands around this very quickly so that there can be an isolated understanding of how to respond and that everyone else can know that they are fine.
Dr. Scott, do you think Trump is doing a good job? Do you think Trump is doing a good job?
All right, we're done.
Right?
Thank you, guys.
Gentlemen,